wish there was a teaching of like, here's what your pregnancy journey could look like early on or even before you get pregnant. Hello, everyone. Welcome to Sex Positivity Unfiltered, where we talk about sex and we are not polite about it. My name is Lyndsey Murray.
And I'm Denise Stratton.
And today we are covering what no one tells you about pregnancy. And so this episode is a little unique. I think it's different than our normal format. So for our listeners who didn't know, I am pregnant and very close to baby being here. So
very close.
Yeah, just a couple of weeks away. And so for this episode, it's just going to be Denise, you asking me questions, and I'm going to share what I have personally experienced in pregnancy and kind of what my journey was, and just a lot of things I think a lot of people don't know until you've been through it. Yeah.
So to get us started, I would love to just kind of go off on a baseline, because the title is what you weren't told. So I want to know what did you expect from pregnancy? Like, whenever you were pregnant, was there education you already knew? Did anything your mother told you? Like, what was your baseline?
No, my mom never told me anything. I think my baseline was pretty basic, honestly. I think what I expected was just, you get pregnant, you get bigger, there may be some pain, you might feel sick for a while, and then baby comes and you're good. Even the difference between vaginal birth and C-section, and there's so much that I just never thought about, right? I just thought, you get pregnant, you have a baby, right?
That's the baseline I have.
Yeah.
You get pregnant, I know you get bigger, there's stretch marks, so I know to expect stretch marks. I know to expect morning sickness.
Mm-hmm.
And I know that your ankles swell and you have back pain.
Yeah.
And those are, and of course your senses are like Superman. So
yeah, you can smell a lot more strongly. You expect to gain weight, but even from the weight aspect, no one really talks too much about that. It's just very basic information.
Okay.
Is what I knew.
As far as education for your baseline, never discussed anything about pregnancy in school. No, nothing. Literally, you had to figure this all out on your own.
Mm-hmm. Yeah. I mean, the education was like in school or high school, just don't get pregnant.
Yeah, accurate.
And no one really talks about all the complications that could happen. Not that I want to scare anyone away, but I mean, there's so much that can happen in pregnancy that you just don't know about. One thing that still blows my mind and kind of freaks me out is that pregnancy really affects your teeth.
Really?
Yeah. Because there's nutrients in your gums that go to the baby. So I've had to go to the dentist double the amount that I would normally go. Because when I went, I was probably 4 months pregnant maybe, and I was already forming gingivitis.
Wow.
Yeah, which I had never not had before. And they told me it's the pregnancy. Yeah.
Oh my God.
So you have to really keep up with your dental care, especially in pregnancy, because I mean, it affects your teeth. It can shift your teeth.
Wow.
Mm-hmm. So I've had some moments it'll be days in a row, maybe a week, where my teeth really hurt.
Do you know exactly what nutrient she's taking? As far as
I don't really know. Yeah, I don't really know the science behind it. And it's also not only nutrients going to the baby, but you're creating so much more blood in your system. So I probably right now I probably have 50% more blood in my system than I normally would, and it can cause your gums to inflame.
So crazy.
Yeah. So when I have pain, sometimes I have to evaluate do I go to the dentist? Is this just inflammation? And sometimes it's just inflammation. It'll go away, but then it'll come back, and then it will. So even that, I never knew that it could affect your mouth and your teeth and your gums. Yeah.
Okay, so for full disclosure, right before this episode, I did watch a tiny little TED Talk on what happens to your body on pregnancy. And one of the things they did cite was you produce more blood because, of course, the baby needs blood as well.
Yeah.
And then your heart, because of that, your heart is beating and pumping much faster.
Yeah.
So your heart rate's higher than what it normally would be. So your body's literally working overtime.
Yeah.
The entire pregnancy, which is so crazy.
It's crazy, and it affects your blood work. Like, I was pregnant before and then miscarried. And then, like, right after that miscarriage, went to my, like, regular doctor, my primary doctor. And, you know, like, every year you get your lipid panels done and whatever. And my cholesterol was, like, through the roof, which I've always had high cholesterol, but this was, like, especially high cholesterol. And then I got pregnant again, like, right after. And I even learned more about that, of, like, pregnancy can impact, like, your lipid panel.
Interesting.
Yeah. So ever since I went through all that, I just told my doctor, I was like, I don't want to check up on that until I'm no longer pregnant again, to see what my levels actually are.
Yeah.
Right? Because there's just so much going on. Yeah.
Actually, yeah, and to speak more on that, I've seen a post that you shared on Facebook where you were pretty much listing all of the things that you're having to do right now. So if you don't mind, for our audience, like, if you want to say all the, I guess, the changes that you're having to deal with at this moment.
Yeah. Oh my gosh. I'm like, where do I even begin? It's such a long list. Yeah, there's so much. My husband and I had, like, infertility issues for quite a while, like almost a year and a half, I guess, maybe. And then I got pregnant and miscarried at 9 weeks. And there was really no solid explanation for why that happened, which is, I mean, good in a way, because it's like nothing was gravely wrong with me, but also kind of frustrating because you're like, why did this happen, right?
Of course.
And then I found out that I possibly, and again, this is not like concrete evidence because all the testing, it's not always like black and white, but they suspect I have, like, a clotting disorder. So essentially, if you have, like, issues with blood clotting, it can cause a blood clot that, like, prevents your placenta from taking over and, like, nutrients getting to the baby, and that could have caused the miscarriage. So because of that possibility, I've had to take Lovenox shots every day this pregnancy. And Lovenox is basically, it, like, helps prevent clotting. So that way nothing gets in the way of, like, what the baby needs. So there's that shot every day in your stomach. And sometimes it hurts. Sometimes it burns really bad, like, depending on where you administer the shot, right?
Yeah.
So there's that. The nausea was really bad for, like, the first 15 weeks probably. And it gets really hard to work when you feel that sick.
Oh.
Yeah. So I've been taking medication every day for nausea. And I don't, like, throw up anymore, but I did for a while. And then recently, maybe the past, like, month or so, I got diagnosed with gestational diabetes, which I didn't know that was a thing. I had no clue. So I went through all that testing, got diagnosed with it. And with that, you have to change your diet. You're basically almost tracking your macros. And you have to get so many carbs in and so much protein and
you were logging
vegetables.
your food,
yeah,
right? You
I
had
still
to, like,
have to do that.
Oh
yeah.
my goodness.
And then you check your blood sugar, 6 times a day. And I got put on insulin. So now I take insulin 4 times a day. So it's like all these shots. Like, honestly, at this point, I'm taking like 5 shots a day.
Holy shit.
Yeah, between my legs and my stomach. So there's all of that. And then the dental stuff, like going to the dentist, even more. I can't remember what else I put on that list, but there's so much that, you just don't think you're going to have to think about.
Yeah. Yeah. Because, again, you on the media is where I get my information, right? So literally all you see is someone gets pregnant, they get sick a little bit, and they have to go see the doctor, go through this intense, very, it's what looks like very painful labor, and then poof, baby, done.
And that's it. And then, like, you're good to go. Yeah.
Oh my goodness. Wow.
Yeah. And whenever you have complications, like a high risk pregnancy, well, because I also have PCOS. So I already have insulin resistance, which I take medication for. So whenever you have a high risk pregnancy, like, the further along you get, they want you to go in every week. So I'm at the doctor every single week now. And they're just wanting to make sure everything remains okay. That's kind of where I'm at right now.
The main thing that we're probably going to talk about in this episode is the way your body changes, right? Like the different changes that your body goes through. So I also want to get a baseline on, like, your body positivity scale and how it was before the pregnancy. Like, would you consider yourself having pretty high body positivity, or?
It kind of waxes and wanes. Like, sometimes I feel really good about how I look, like, pre-pregnancy. Sometimes I feel really good about how I look. Sometimes not so much. I will say, for me personally, I've not enjoyed how pregnancy makes me look. Okay. I haven't enjoyed it. I haven't felt confident. And some women really do.
Yeah.
And I really don't.
Okay.
You know, like my libido is much lower. I'm just not in like a sexual space, if that makes any sense. One, just because of the physical discomfort, but then it just, your body's just bigger.
Yeah.
And I know it won't be this way forever, but yeah, it's been hard for me to remain confident. Yeah.
That whole what do people they see like they feel the glow and they how did Kat say it? We had an episode a little bit back where she said she really enjoyed the I guess the maternal instinct that came with the body positive or her body changing, right?
Yeah.
But it's just been more of a like
I have not felt that.
Okay,
I have not felt that at all.
I love that.
I'm kind of like, I'm ready for this to be over. I'm ready to like lose the weight that I've gained, get back in my regular pants. Like that's where I'm at, know?
Hell yeah.
So yeah, I think it affects every woman differently.
I love that. Yeah. Okay. And then so now I want to get into, because one thing I will say, and I don't know if you have a different appreciation for what your body can do and how just the human figure is able to adapt, but specifically a woman human figure is able to, because so baseline in the TED Talk, I think the first thing that they said is like your breathing starts becoming more short because as we talked, you were producing more blood, which means that your lungs are having to pass more oxygen to the blood. So do you feel that like shortness of breath like everywhere?
Yeah,
really.
I do. Shortness of breath, and then also like the shortness of breath has gotten better.
Okay.
Because like the closer you get to the end of your pregnancy, the baby gets lower, and so they're like off of your lungs, right?
Oh, okay.
So right now I feel like my lungs are back. But there was a period of time where she was really high up and it was really hard to breathe, like especially when you sleep.
Really?
Yeah, especially sleeping. Like just no matter what position I would be in, it just felt really hard to breathe.
Oh man. How is your sleep schedule during the pregnancy?
Horrible.
Yeah?
Yeah, horrible. That's another thing they don't tell you about is like the insomnia.
Okay.
Yeah, there's definitely insomnia associated with pregnancy. And like you aren't supposed to sleep on your back. Because it can affect like oxygen flow to the baby. That one, I don't know how much science is behind that. My doctors never really mentioned it to me.
Okay.
But you see that information everywhere. And sometimes there's nothing you can do about it. Like sometimes I've woken up and I'm on my back and I'm like, I don't remember going on my back. So like, what can you do?
Yeah.
But they prefer you to sleep on your side. But that's not always comfortable either, Yeah. So there's really no comfortable position. I tend to wake up at like 2 or 3 in the morning, and then I can't get back to sleep until like 6, maybe.
Holy shit.
Yeah, that's like an everyday
girl.
Yeah.
Oh man. Okay. How does it affect your like I guess your routine?
I've had to take the mornings a lot slower.
Okay.
I have to just go really slow in the mornings, like take my time, eat breakfast. Because I'm not really a big breakfast person.
Okay.
I used to be like, wake up, shower, get ready, come to work, like boom, 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 I'm ready to go. Now it's like I get up and then I have all the medication I take and the shots I have to do. And then I make breakfast and I kind of like watch TV for a while. I'm lucky that I have a job where I can like adjust my schedule because I see clients later in the day now. Instead of having like a bunch of morning stuff to do,
get it.
I start late morning, maybe like 11 o'clock or something.
Okay.
So I have more time to get ready. And then you're also just tired because you don't sleep very well. So that part is hard too. Just getting up and around is like slow going for sure.
And I mean, girl, luckily you can change your schedule. That's to be honest, that's a blessing.
Because not everyone can. Like some people still have to be at work at 8 a.m. and cannot imagine having to do that.
Yeah, so your perspective on like now that you've gone through pregnancy, you understand. Like I guess there is a reason why people have to take the time off.
Yeah,
to be able to,
for sure. Yeah, absolutely. Like and you also hear of some employers just being shitty.
Hell yeah,
they don't care what you're going through. They're just like, you need to be here up until the day that you give. I mean, some women do work until they're like going into labor.
Yeah,
but that's America.
Yeah. So the next change I learned today was basically your body starts immediately producing progesterone. And this is a specific hormone that will loosen your muscles. So obviously making room for the baby and like your abdomen and things, but it'll also loosen the muscles of your digestive tract. So that's where unfortunately things like constipation and the one thing that I hear from every pregnant woman is heartburn, right? Because so have you seen an uptick in like?
Oh yeah,
yeah,
heartburn, acid reflux. I have to take Prilosec every day. That's the only thing that has worked to help with heartburn. Like, I've gotten medication from the doctor. I've tried different over-the-counter medications, and there's always heartburn. And it's uncomfortable. That's another reason why you can't sleep, because, like, no matter what position you're in, you're just, like, breathing fire is what it feels like.
Yeah.
So it's, like, super uncomfortable. The progesterone, that's another thing I had to do. I had to take progesterone suppositories the first 12 weeks.
Okay.
And this is like kind of gross, but it's a vaginal suppository and it's orange.
Interesting.
I had to take it every day for 12
Okay.
weeks, because that was another thing. Like, when I had the miscarriage, it was like, if your progesterone levels are too low, then you're like at more of a risk of having a miscarriage. Like, it's not good for the baby,
Yeah.
because like your body does produce it, but it might not be enough.
Yeah.
Right. So I do that for 12 weeks. And I hated that. That was like, I would rather do a shot than have this like orange pill up your vag, because then there's like discharge.
Was
all the
it
time.
like a big pill?
Yeah,
or-
it's like it's like this.
Holy.
Yeah, and you like put it up there, and
Oh
then
my God.
you can do it at night, but it's like you would wake up and there would be all this discharge.
Oh yeah.
Awful. And but I had to do it. So I remember counting down the days. I was like, the minute I hit 12 weeks, I'm fucking done with this shit. Like, that was probably the worst medication I've had to do.
I've never heard of those things. Wow. I'm learning a lot today. So
Yeah.
I'm sure you've learned a lot over the past
Yeah.
past 5 months.
Yeah. You'd be surprised how many women have to do that.
Okay, so as far as like your access to information, what does that look like right now? Like, does your doctor warn you about things that are going to happen, or they just is purely reactionary?
Kind of both.
Okay.
I really like my OB-GYN, so I feel like he'll prepare you for like possibility of stuff, and then he's also good about running all the correct tests and kind of telling me what he's thinking and what he thinks I should take and why I should take it. So it's been a combination of both. I feel like you really have to have a good doctor.
Okay.
And there's also Facebook groups that are really helpful as well. Because sometimes you just want information in between your appointments. Because like in the beginning of pregnancy, you don't go into the doctor that much. Like, you get your first ultrasound, it might be like 2 months until you have another one.
Oh wow. Okay.
And then as you get further along, you go in more. Now I'm going so often, I'm kind of like over it. I'm like, I wish I didn't have to go in again. But in the beginning, you wait quite a while between appointments. My doctor, I can always message in the portal and he'll always answer. But I like having the groups too.
Yeah.
Of like other individuals who have like gone through
Oh hell yeah.
this journey, and like they know things, and yeah.
So your access to information is really, it's something that you have to seek out pretty much, especially in the first. Wow.
Yeah. Like reading books,
Yeah.
going to the groups, asking your doctor. I think if I had any advice to anyone, it would be to advocate for yourself.
Okay.
If you're not sure of something, you have to ask, because no one's going to really tell you unless you do,
Yeah.
for the most part.
And have you ran into any misinformation whenever or any myths that you see spread around a lot?
I'm trying to think. Not so much. I think the thing to be careful about is that not every piece of information is going to apply to you.
Oh, that's good advice. Yeah.
Yeah, because you might see something and you're like, oh, I didn't know that, or I didn't know I should be looking into that. But that might be someone who had diabetes before pregnancy, and so their journey is going to be different than mine, right? Like, as an example.
Okay.
So that's just something to be cautious of when you're looking up information. Don't let anything freak you out. You have to look at your own situation. And then if you do see something online where you're like, I don't know about that, I should look more into that, just ask your doctor.
Okay.
Because they know you and your stuff, and they'll be able to tell you what applies and what doesn't.
And what about husband wise? Anything that's kind of surprised him, or have you let him know everything that goes on with your body, or is there anything you keep to yourself?
No, I let him know everything that goes on.
Okay, good.
Yeah.
Good.
I think he's been surprised at like how much I've had to go through.
Yeah, I'm surprised.
Yeah, I think he's been surprised by that. Every time something new comes up, it's like, damn, I didn't know that. So he's kind of right there along on the journey as well. And something too, like in your first like few ultrasounds, there can be like hemorrhaging. I don't know if there's like a technical term for it. But when you hear that, you kind of freak out because you're like, oh my God, what does that mean? Like, is that like an issue? Like, what are we going to do about that? And a lot of that will sort itself out on its own. And it's just something that they monitor, right?
Okay.
That's what happened to me. So even this pregnancy, it came up and I was like, oh no, like, what's that spot on the ultrasound? What does that mean? And then when they tell you like, oh, it usually works itself out, that's hard to trust.
Hell yeah.
Like, how do I know it's going to, and it did.
Okay.
It did. So there's some stuff that is, again, you don't know about.
Yeah.
You just think everything's going to be normal.
Yeah, I'm gonna get a little morning sickness. I'll have to throw up. I'm gonna crave some weird pickles and ice cream together or some shit. And then boom, baby. Okay, so this is obviously a sex positive podcast. So if you feel comfortable, how has your libido been? Like 9 months? Like, has it been completely non-existent?
It's been really low, really low. Yeah, we haven't had a lot of sex ever since I've been pregnant, but I have a very understanding husband. Like, that's not been an issue in our relationship. There's times where it shows up and I'm like, hey, this is great. Okay. And then, but for the most part, I'm just so uncomfortable. I don't like how I look. Yeah. You know what I mean? I'm just not in that sexual space. And again, every woman is so different. Like, some women, their libido goes up during pregnancy, and that's like time of their life. It has not been that way for me at all. Yeah. Okay.
Is it, and just the thought, you said mostly uncomfortableness. Yeah. Does the pain on the times that you have engaged, does the pain or uncomfortableness really affect the I guess your ability to even enjoy?
No, luckily not. Okay. I think you can find a position that works for you. Okay, good. And then it's been enjoyable the times that we have. So that hasn't really been an issue. And also we're really good about, like, if something was, like, if we started having sex and it was uncomfortable, we would just try a different position. Like, we would, I feel like you can always make it work, whether it's penetration or not, at least doing something. Oh yeah. So we would have made it work, but no, I've been lucky in that regard. Okay.
Then shifting from libido, what about your mental health, girl? Like, how's it been in the 9 months? I assume at first it was so exciting and everything was great.
Yeah. I think I've had a lot of anxiety and some depression, but also, like, I can't, I haven't been able to take my Adderall this whole pregnancy.
Really?
Yeah.
Well, oh yeah, that's right. So there's a lot of medications that, like, you can only pretty much take Tylenol, right?
Yeah, only Tylenol. No ibuprofen. No other things. I should note, depending on the circumstance, there's some like mental health medication that you can take, and I think Adderall to a certain point you can take. Like, if I really wanted to take it, I'm sure I could have found some. I could have gone to like a psychiatrist and found some dose to monitor, right? So I don't want anyone to think it's like just off the table. Yeah. I think because we miscarried before, I'm going into this one like I don't want to risk anything, so I just decided like
extra cautious.
My primary doctor and my OB-GYN were both like, I wouldn't recommend Adderall. So I just stopped taking it. For me, taking Adderall is not just, it is for ADHD, but it also addresses like anxiety and depression for me. So without that, it's been really hard.
Wow.
Yeah. And just all the changes your body goes through, like, doesn't help as well. So yeah, I would say my anxiety's been really bad. Yeah. Worse than it normally is.
Do you know if taking breaks is that going to affect anything later on, or?
No, I don't think so. Okay. No, you can take a break and get back on medication.
But you just have to go through the suck for a little while.
Yeah, exactly. And then you get into like breastfeeding. Like, there's certain medications they don't recommend when you're breastfeeding.
Oh yeah, shit.
So I have to evaluate that, and so it really could be like a 1 to 3 year period where you don't take the medication you would normally take. Wow. But again, everyone's so different. Yeah. For me, right now, I'm just not on any of that.
ADHD, remind me, you're not able to focus on topics, correct? Like, it's hard to...
Yeah, it's hard for me to focus. Like, concentration is really hard. But also motivation is really hard.
Oh, yeah.
When I'm on Adderall, I'm more motivated. I can get more things done in like a more quick manner. It almost feels like my brain is on like slow motion mode, like even at work, I can just feel there's like a slowness to my brain, if that makes any sense. Yeah.
I actually, even without the ADHD, I was told that's like a normal thing in pregnancy too, right? Like brain fog, or what do they call it? Pregnancy brain.
Yeah, it's brain fog. Yeah, for sure. So it's just kind of like a little delay of like, okay. Oh, okay, yeah. And then like you just figure it out from there. So it's tough. Mm-hmm.
And the 40 weeks at 38 weeks now that you've
Mm-hmm.
experienced, what would you say was your biggest high point?
It's a really good question. I mean, making it past the first trimester for sure.
Okay. Oh, yeah.
Yeah.
Big
Because
moment.
when you miscarry, you're terrified you're going to miscarry again.
Oh, yeah.
And it usually happens in the first trimester. So getting the second trimester was good. And then like another high point was after like 15 or 16 weeks, my nausea started going away.
Okay.
And I had more energy. So that was a high point as well. Like being able to just not be sick all day was nice personally and at work. Another high point is around like 10 or 11 weeks, they'll do genetic testing. And so the genetic testing will test for certain genetic issues that the baby could have.
Okay.
And then if it comes back positive for any of those, you go in and get further testing and it'll kind of confirm, if your baby's going to have some complications. All of ours came back low risk. So that was another high point. Because again, you're just scared. You're just okay, I'm reaching into the first trimester. Maybe I'm not going to miscarry. And then you get the testing done. It's like low risk. From there, I think every high point was just those check-ins where the baby's okay. And you're like, okay. And then a week later, you're like, but what if something changed, And it's like it's like, again, my anxiety is really bad. But I would say those have been the high points for me.
Okay.
A combination of that.
Like I'm noticing like almost like a maternal protecting where you're more concerned about her than
I think so. I think a lot of people feel that way. It's like you don't worry about yourself so much, you worry about them.
Okay.
Because they're literally like developing their lungs and their kidneys and their eyes and their feet and like, it's just kind of crazy because it's like, what if something goes wrong? Because something could go wrong. And like another high point is when you can start feeling the kicks.
Oh, really? Oh,
yeah.
really? Yeah.
Yeah, and when Andrew felt it for the first time, that was definitely a high point.
Oh, hell yeah.
And it also gives you some confirmation because for a while it doesn't feel real. Like when you're like in the first 3-4 months, you don't feel anything, so you're just like, okay, I guess this is real. I don't know. And then when you feel kicks, it's like confirmation.
Mm-hmm.
Okay, they're there, they're moving, and then the further along you get, you feel them all the time.
Can you kind of feel her like maybe communicate with you like when she doesn't like something or does that ever happen?
Yeah, when I eat certain things. I feel like she's like rolling around in there, And then if you're really active, she'll move less. Like when I'm like walking around and doing stuff and I'm like really busy, I feel her less. But when I finally sit back down and I'm resting, then she's like kicking it up a notch.
Okay.
Yeah.
Okay, that's cool. And what about I guess your surroundings? Have other people treated you differently? Let me start there.
Not so much, which I'm thankful for.
Okay.
I don't really want to be treated differently, but the only way people have treated me differently is that they'll like go out of their way for me. Like they don't want me to pick anything up. They don't want me to get water. They're like, I'll get you water. My husband's done more of the cleaning and the cooking, like that kind of stuff.
Okay.
Which is necessary. Especially the further along you get. It's like, I'm really uncomfortable. I don't feel like getting up. I definitely can't like do a whole bunch of stuff in the kitchen or whatever. So in a way, yes, that's how I would say people have treated me differently.
Okay.
Yeah.
Okay. Does any mothers want to give you like extra advice or do they want to talk about their pregnancy? Is there like, have you gotten any community?
Yeah, I have. And it's been really nice. Like I don't always enjoy unsolicited advice, but not a lot of people have really done that though. Like the advice I've gotten has been more like do things the way you want to do them has been the advice, and not so much like here's how things should be and here's what you should do. I haven't gotten any of that, which I'm very thankful for.
Oh, yeah.
Yeah.
Is there anything else that you really didn't expect that's happening physically, mentally? Like what was your biggest surprise?
Well, I'll go back a little bit to like the journey to getting pregnant.
Oh, please, yes.
Yeah. So not everyone just gets pregnant naturally.
Yeah, okay.
Which is another thing you just expect will happen. It's like, oh, you're not on birth control anymore. You'll get pregnant, no issue. For me, as someone with PCOS, for a while there, I couldn't track ovulation. Like that's always what they want you to do. Like if you haven't gotten pregnant but you want to be, they're like, okay, track your ovulation. And there's like little test strips you can get. You're just kind of keeping track of like when your period is, how long your cycle is. and about when ovulation would happen. Ovulation usually happens like right in the middle of your cycle, but with PCOS, my cycle would be like 50 days, right? As opposed to 28 or 30. And so that became really difficult to track. When am I ovulating? And am I even ovulating at all?
Okay.
Right? Because some women don't ovulate on their own.
Can you first just briefly, what is PCOS, just for our audience members who
yeah, it's polycystic ovarian syndrome, right? And so it's like cysts on your ovaries. I think it's more complicated than that, but it can create issues with ovulating, right? Because it's like an issue with your ovaries, and then it also creates insulin resistance,
Okay.
right? Which also affects your cycle and your cycle length.
Okay.
So I have that, but I didn't know I had that for a long time. I just knew I was on birth control for so long, and birth control can regulate your cycle. So when I got off of birth control, it was kind of like, why am I not getting a period? What's happening?
Okay.
And so like when you're going through that, then there's that question of like, am I even ovulating?
Yeah.
Right? Because if you can't really track it, if you're not ovulating, no matter how much sex you're having, there's not going to be a pregnancy, right? Mm-hmm. I eventually got on metformin, which helps with insulin resistance. It can be a diabetes medicine. I don't have diabetes, but I have insulin resistance, just meaning my body doesn't make enough insulin. And it did help a lot because my cycles became more regular.
Okay, good.
After taking metformin. But I still wasn't clear on if I was ovulating or not. Yeah, because I would do, they have like these little, they call them like ovulation predictor kits, like OPK. And so you test your urine and
it's like a little paper strip.
Yeah. Okay. And if it comes up positive, then that means like there's a high likelihood that you are about to ovulate or you have ovulated. I would never get a positive, right? So every month it gets kind of devastating because you're like, is this ever going to happen for us? Eventually we started doing like Clomid and Letrozole, which like help your body to ovulate. When you take those medications, you go in every month at a certain like day of your cycle, and they'll do an ultrasound and they'll look at your ovaries, and they can tell based on like follicle size, did an ovary go through or not? Not an ovary, for an egg to go through or not. And every month I would go in, they were like, you didn't ovulate again, or there's no sign that you're about to. So it was just like, man, what's going on? That journey gets very depressing, right?
Oh, hell yeah.
Yeah. And so if those medications, like, they only want you to do so many cycles of the medication. Okay. And then if that doesn't work, you can look into like IUI or IVF. There's like other things you can look into. We were on that last month of Letrozole. And I went in again. They were like, no sign of ovulating, no sign of an egg getting through. And my doctor was going to send me to a fertility specialist. We actually did end up getting pregnant that month. Yeah, but that's when we miscarried. Like that pregnancy is when we miscarried. And then with this pregnancy, we were going to take a break. So I was like, I'm tired of this medication. Because the medication does mess with your hormones and all kinds of stuff. Okay. And I was like, we're going to take a break, not worry about the medication, whatever. And then we got pregnant naturally this time. So it's just really weird how that happens.
Hell yeah.
Know? Yeah.
Oh, yeah. The body's weird.
Yeah. So I'm explaining all of that because, anyone who's listening that is having trouble, there's options out there, but it's not an easy road to go down. Yeah. Right? Because it can take a long time. Maybe it takes no time at all. You just never know. And then with like Clomid and Letrozole, it's not just those medications. There's other like supporting medications you have to take throughout the cycle to like support that medication. So there was a time before I was pregnant, it was like 5 or 6 different medications that I would have to take sometimes it would be every day, but like you take some of them at certain days of the cycle and others at other days of the cycle. So I would have to have like a calendar of, okay, take this pill cycle days 1 through 3. Wow. And this one is cycle days 3 through 7. And this one is that like, it was a mess.
Just to get pregnant.
Yeah.
Just, and, some people it just takes a one-night stand at a club. It's so crazy how
I know. Sometimes when you have to plan it, it's just frustrating. And then to go in and see on the ultrasound, oh yeah, your follicles aren't big enough. It doesn't look like you're going to ovulate this month. You're like, damn.
Yeah.
Went through all this And this month was a bust.
Shit.
Yeah.
Yeah. And that's a lot. That's even a lot of money too. I can't even imagine. You're actually the second person that I've heard that started taking a bunch of medication, had to do a lot of tracking, even went to a fertility clinic specialist, everything, put a bunch of medication. And then as soon as they stopped and were pretty much, let's take a break, then bam, pregnancy. So
yeah, it happens like that. It's like you can try everything and then, you know, something happens, you take a break, you miscarry, whatever, and then it can happen right after that.
Yeah. Yeah. I'm glad you're speaking to how difficult it can be to get pregnant. Like that's something that I feel like a lot of people don't even know.
Yeah, and they'll also, like, if you are having trouble for long enough, I think they say if it's been like a year of you trying on your own and nothing is happening, they'll start different interventions. They'll do what's called an HSG, which is like, it just basically checks to see if your fallopian tubes are blocked. Because if you have a blockage there, that's going to prevent you from ovulating. So I did that. I didn't have any blockage. And they'll look at, like, Andrew did a semen analysis as well. Because they do. I mean, I feel like women always think it's on, like, if it's not happening, it's on them. But it could be your partner that's having issues. Right? So they looked at him and he didn't have any issues either.
Okay. How soon into being pregnant do you know that, did you catch it? Like, was it within weeks or how?
Yeah, I think I was like 4 weeks along when I got a positive test.
At that point, what does that transition look like? Like, whenever you go from being this trying to get pregnant person to now being pregnant, I assume obviously medications are gone, drinking is gone.
Yeah.
But is there anything else that I guess no one really knows?
That early on, there's not a lot to really do. Yeah, like the obvious, like, don't drink anymore, don't smoke.
Yeah, no smoking.
You know, stuff like that. You don't have to take fertility medication anymore if you get a positive test. You do want to, like, get with your doctor as soon as possible, though, because they'll confirm it. Because that's another thing too. This is another thing they don't tell you about. Okay. Like in very early pregnancy. Just because you get a positive test doesn't mean it's a viable pregnancy, right? Like, you're technically pregnant. Like, it's like the hormones are showing up on the test for a reason, right?
Okay.
But you can go in and they'll look at, like, the sac in your uterus, and sometimes there's nothing there. So it just means, like, your body's producing the hormones, but there's no, like, fetal pole, there's no start of a development of a baby, and they consider that a miscarriage. Yeah.
Interesting.
So I think a lot of individuals have gone through that too, like that devastation of, okay, I am pregnant, it's showing up positive on the test, I'm going to go in, get it looked at, and then it's just empty. I think they call it a blighted ovum. That's what it's called.
Okay.
Yeah. So then after miscarrying, knowing that that's a possibility, even when we knew that I was pregnant, like, early on, I was still terrified to go in because I was like,
what if
they could look and there could be nothing there.
Wow. And then that, especially for someone who's wanting to get pregnant. Wow. Girl. Okay. So you have to make sure that it's viable. That's insane. I had no idea.
It could be that. It could be a molar pregnancy. A molar pregnancy is like, I think it's like precancerous cells that, like, produce the pregnancy hormone.
No way.
But when you go in, it's just, they call it a molar pregnancy. Like, there's no baby there, but there's, like, precancerous cells there.
Oh, fuck. Talk about bad news on top of bad news.
Yeah. And, like, I have a family member that had that and had to have it removed, had to have, like, a bunch of, like, cancer screenings, and, like, there's, like, all this extra stuff that comes with a molar pregnancy. And I think they advised her to wait, like, a year before she could try to get pregnant again because of that. And so that's another thing. Like, it's rare, but it could be a molar pregnancy. So when you go in for that first ultrasound, it is scary because you're like, there's no guarantee that this is actually a baby, you know?
Holy shit. Yeah. Yeah. Speaking of scary, and speaking of doctors and what legally constitutes as a miscarriage, I'm curious. I do want to mention that we're in Texas, so we have certain laws. Did you ever see that come into effect with, like, how your doctor approached things?
No, not so much. Okay. My doctor is very progressive. Okay. I think I haven't talked to him too much in depth, but I do know a little bit about, like, his politics and where he stands. And my doctor is very much like patient first. Like he's going to do whatever the patient needs,
Okay.
kind of person. So nothing like that ever came up for me. But it is scary.
And do you have fear just knowing possibly what could happen versus like what they're able to do legally?
Yeah, for sure.
Yeah.
Yeah, it's very terrifying. Because, if something were to happen, I think I'm far enough in pregnancy that I think my risk is low. But, like, over this past month, right, for sure, there's that fear of, like, if they find something wrong with the baby, but the baby still has a heartbeat, but they know this is not going to be a viable pregnancy.
Yeah.
Right? Like, this is not going to result in a live birth, right? Because of the abortion laws, there's nothing they can do. Like, they can't terminate the pregnancy if there's still technically a heartbeat. And so what's scary about that is that in the waiting period for the heartbeat to go away, some women are developing infections like sepsis. And that's what they're dying from, is like the infection that comes from having to wait because they can't get an abortion, like even if it's medically necessary. So that fear has gone through my mind where I'm like, what if I go in and they're like, hey, something is gravely wrong with the baby. The recommendation is to terminate it for your health too, right?
Yeah.
Not just because it's not viable, but it's like, this is affecting your health as well. And in the interim, while you're waiting, you get an infection. That's pretty scary.
So let me just summarize this like in very simple terms. So we're saying that there could be a situation where a mother goes in and the baby, when you say it's not viable, that means literally there will be no baby at all. So this is now turned into like a medical issue. And it's more of because we do treat babies in the pregnancy as babies, but this is more of an infection that's developing in you. There's no baby anymore, but unfortunately, because of the way biology works, there's still a heartbeat that matters way more.
Yeah, exactly. And so it like, whenever you hear women who are like, these like policymakers and like individuals, especially where we are in Texas, care more about an unborn child than they do the mother. That's essentially what they're saying, is like, well, they still have a heartbeat, so we have to we can't do anything about it. To me, that's really unfortunate, because as much as I love this baby I'm about to have, I am more important than her. And I'm not going to apologize for that. You know what I mean? Like, I have a life already.
Oh, hell yeah.
And I have responsibilities, and I have relationships, and so if it ever came down to it, like, I would want to be chosen first.
Have you had that conversation with your husband on what would happen? Okay.
Oh yeah, I've told him, I'm like, if it ever came down to it, like, you would have to choose me, and he's in total agreement of that.
I would choose my spouse, to be honest.
For sure. Yeah, like, that's how. And especially, like, this is our first child, but imagine if we had like a couple of kids already.
Oh, hell yes.
Right? Like, now I have people to take care of, and I want to be there for that. And so, the abortion law stuff, I think people simplify it into like, you're murdering babies. No, not really.
No, it's because they hear the 9 months, and a baby was technically, by the legal definition standards, was aborted at 9 months. And unfortunately, there was a medical procedure that happened in order to save someone's life. Like, that's really what it means. But
and for anyone listening, like, in Texas, it's a total ban. It was like, up until 6 weeks, it's 0 now.
Yeah. It doesn't matter if a 12-year-old's pregnant. It doesn't matter if the baby is going to be a product of incest. It doesn't, none of that matters. Literally, if you are a woman here in Texas and you get pregnant, you have to carry that baby to term no matter what. Yeah. So it can be very scary. Yeah. And I do want to actually go back and speak to, you said you did kind of look up your doctor. How did you pick that? Like, was there research that went into it? Do you recommend mothers to research their OBG? Or
yeah, okay. I would just ask them direct questions.
Really?
Yeah, okay. I think you can ask your doctor direct questions, right? Of like, where they stand on certain issues, and because I think there needs to be some alignment there, right? Like, I wouldn't be comfortable going to a doctor who is 100% anti-abortion, like I wouldn't be comfortable with that.
Okay.
You know, and even, I mean, it's complicated because like we're in Texas and you can't get an abortion ever. And so like I understand the perspective of like your doctor might be limited on what they can do because of the legality of it, but their worldview and their beliefs still matter to me.
Okay.
Right? Because I want to go to a doctor who would like validate my fears, even if they're limited in what they can do. I want to go to a doctor who's going to say like, you totally should be worried about that. And here's what
here are the options
we would do if someone get like, right. I wouldn't be comfortable going to someone who's like, yeah, I don't believe in abortion, even if medically necessary.
So I can make you comfortable, but we're going to have to do this way.
Yeah, I wouldn't. That's not for me.
Yeah, that's fair.
So yeah, look into them. Look up their reviews. You know, ask them whatever questions you want. That's what I would recommend.
Okay. Hell yeah. Wow. Actually, now we're coming at the end of the time, but what advice do you got, girl? Like, what is something that if you could go back to freshly pregnant Lyndsey and tell her, hey, this is about to happen. No one's going to say shit about it, but this is about to happen. What would it be?
My advice is always to do a bunch of your own research. Okay. For sure. Ask questions, take classes.
Classes? What classes?
Yeah. They're like, we've gone to a few classes that are like baby prep classes and like baby safety classes and how to install the car seat correctly. And,
wow.
Yeah. Like we went to that, which is very helpful because they help you install the car seat. And then they also help you like learn how to use like the harness feature. And there's just there's all this stuff that you like don't know, right? There's like pumping classes, there's breastfeeding classes, there's like so many options you can do. It's all overwhelming. So don't overwhelm yourself with classes because you'll forget some information. But like pick the main things you're the most curious about and learn about those. And also look into you'll hear they recommend like having a birth plan. Which I have a birth plan now. But when you hear that, you're just like, what the fuck is a birth plan?
I was about to say, what is a birth plan?
Yeah. And at first I'm like, I have no clue. My plan was just like go to the hospital and have them do whatever. But the birth plan essentially goes over like, do you want an epidural or not? Do you want to do no medication? What do you want to do in the case where like a C-section is necessary? Because I think everyone imagines you go and you have a vaginal birth. That's all fine and dandy, but sometimes you can't have a vaginal birth. Like if the baby is breech, like if the baby is feet down instead of head down, you can't have a vaginal birth. You have to have a C-section.
How would you prep for that? Like, what do you need to, like, is there like certain questions you're prepping for? Like, what do you mean?
Yeah, like you would, because when you have a C-section, I mean, they essentially are like cutting you open to get the baby out as opposed to vaginal. And so you want to look into like what all that entails, right? Because that... with like a C-section, you could get an epidural. It could be like general anesthesia. It could be, if it's like an emergency C-section, you might not be awake for it. But if you have like a planned C-section, you are most likely going to be awake for it. You want to look into like what the recovery of that is like. Because the recovery from a C-section is going to be much different than the recovery from a vaginal delivery. And then you'll want to look into like side effects of the epidural or like Pitocin, which could help speed delivery along. There's side effects of that. And so there's just all these really things that you want to figure out. Like how much fetal monitoring do you want to have? Do you even want to give birth in a hospital, or do you want to do a home birth with like a doula? Like there's just so many options that you can look into. I know for me personally, I want to be at the hospital. I want my doctor there. And I want all the pain medications that they're going to offer me. Like, that's me for sure. I'm like,
numb me up.
Yeah. I want to feel as least as possible. And then you also look into like signs of going into labor. Okay. Because it's not like your water breaks and then you go in. It's actually the opposite. Usually you'll feel contractions way before your water breaks.
Interesting. Okay.
Yeah. Just tons of stuff to look into. And your birth plan just goes over like, do you want like immediate skin to skin with the baby? Do you want your baby to have all the vaccines? Are there certain vaccines you don't want them to have?
Oh, wow. Okay. Mm-hmm. Okay.
Yeah.
Understood.
Do you want, there's a lot. The good thing is you can look up templates of a birth plan. Okay. And kind of pick
that's
options.
Good advice.
Yeah. Because if you're doing it from scratch, it's like pulling something out of your ass. You're like,
Yeah.
I don't even know where to start. So,
No, that's
yeah.
great advice. Okay, so now I have 2 questions on what you just spoke to
Uh-huh.
first. Did you have to pay for those classes or the things that you did?
I went through Texas Health
Okay.
system for these
Okay.
classes, and they were like $10.
Oh, wow. Okay.
Very affordable. There's probably like classes through the county that are maybe even free, but I went to like the hospital system. They're like $10.
What would you consider the most valuable classes that you took?
The most valuable. I really enjoyed baby prep, or there's a more official name, but it goes over like when the baby is here, how they should sleep, right? Like they need to sleep on their back.
Okay.
How to give them a bath, how to change a diaper, how often they should be sleeping, how often you should be feeding them. Like I think for breastfeeding, like that first month, it's like every 2 to 3 hours they have to feed. So you've got to like fit your sleep schedule around that for like the first month. So there's a lot of like little basic stuff that if you've never had a child, you wouldn't know.
Are you planning to breastfeed?
Yeah, that's the plan.
So every 2 hours, girl, get ready. Oh my God.
Get ready. And that might not even work. That's another thing too to be prepared for is
Okay.
like you can have in your head like, oh, I'm going to breastfeed. But some women really struggle to produce milk. And so if you're struggling and you're not producing enough, you might have to start pumping. You might have to supplement with formula. So I'm going into it very open-minded, like, oh, here's my plan, but I'm not like married to that plan.
Okay.
Right? I'm trying to be as flexible as possible. But yeah, that's what I plan to do. And so classes like that are just really helpful.
Hell yeah.
Also how to like swaddle them and all kinds of stuff.
Wow. So there's what I'm learning from this episode, guys, is there's a lot of stuff I don't know about pregnancy.
Yeah.
Yeah.
And you'll figure it out. That's another piece of advice I have to tell myself too. You will figure it out. Anytime that something comes up and I'm like, I don't know how that works. Some of it you're not really going to know until the baby's here.
Okay.
Because your baby's going to be unique. Right? And you'll figure it out.
Okay. And I'm also quite curious, have you felt any type of maternal, like, they tell you that you feel maternal instinct with, your baby, like a connection. Have you felt anything like that before?
No, not really. I don't know if that's bad
Okay.
to say.
Oh, no.
But
Okay.
I'm like excited. Like there's like, she's in there. I know she's in there.
But you don't feel like this overall change that's
No.
Okay.
I don't feel that at all. I don't know if that's going to come when she's here. That's another thing too, is like postpartum depression and anxiety are very real.
Yeah.
That could happen to me.
Are you doing anything to prep for that, or you're just, not sure? Is there even anything to prep for?
I'm not doing anything to prep. I'm just trying to be open-minded that is definitely a possibility. And I know, maybe my like therapist hat is coming in, but like if I did experience that, I know I would immediately contact my doctor.
Good.
And if there's medication I can take, and then I would go and see my therapist. Like for like no matter what. So I have that kind of on my, if I feel really depressed when she's here, I know what to do. So that would be my advice too, is like, I think all you can do is just, you have to be open-minded that anything can happen to you.
Yeah.
And that there's resources out there, there's help out there if you were to need it.
Speaking to the therapist hat and my very educated co-host that I have next to me, what education or resources do you wish was more accessible or out there? Like, is there anything that you think we could do better as a society?
I wish this information was out there. I wish it was encouraged prior to getting pregnant. I guess I should say, right?
Like in high school, or what do you mean? Like
maybe even in high school. Yeah, I don't really have like a great answer to that.
Okay.
But I feel like, in high school there's like the, don't get pregnant.
Yeah.
But it would be nice if there was teachings on like, if you do get pregnant, like, here's the things you could experience. Here's the things to be aware of. Why not teach teenagers that kind of stuff?
Yeah.
You know what I mean? Because it could it could happen to anyone. So do I think we should learn this stuff earlier? For sure.
Or even like when you're first getting pregnant, do you wish that maybe doctors encourage you to go to like this class of like what to expect when you're expecting or whatever that book is? Like, is there anything?
Yeah, I wish we did that. I wish like the because I do think like some stuff, like some of the classes we've taken, makes sense to take later in pregnancy, simply because you can't retain all the information. Like there's some things I've already forgotten. So there's certain things where it's like the further along you get, the timing makes sense, But I wish there was a teaching of like, here's what your pregnancy journey could look like. Right? Like early on or even before you get pregnant. right? Like if this happens, here's the core. Like there could be a class like that, I think.
I like that. Yeah.
And I also wish that they would go over complications to look at, like how the NICU works, because we like one of the classes we went to, this woman was there and she had her twins at 26 weeks.
Holy fuck.
Which is so early.
Yeah. And
they
they're
were
twins.
so tiny. Yeah. Like luckily they had been in the NICU like a couple months already.
Jeez.
Yeah. But those are things you never think of. Like you really just think pregnancy is 40 weeks. It would be nice if someone went over, what if it's not 40 weeks? What does that typically tend to look like? What happens in the NICU? Things like that could be taught earlier on.
Hell yeah.
And then some information it makes sense to keep until later.
Okay. And actually, speaking of complications, were there any times during those 9 months where like you thought that you like were having some type of complication or emergency and you went to the doctor and they were like, girl, no, you're pregnant. That's normal. Like anything like that happen?
Yeah, the pelvic pain.
Really?
And the
so it's pretty
pain.
excruciating.
Yeah, it's pretty bad. I've like asked and they're like, it's just kind of how it is. And they'll look, I mean, they do an ultrasound and they'll confirm if everything's okay. But sometimes it's so painful that you're like,
this can't be right.
Must be happening. And then like this pregnancy at like 7 weeks, I started bleeding. Terrifying.
Oh, hell yeah.
Like when you see blood, you're just like, oh my God, this means something is wrong.
Okay.
And so I went in like the next day and had them look at it and everything was fine.
Really?
Yeah.
So there's times where you literally could just discharge a bunch of blood, and it's
and it's just it didn't last very long. It wasn't like it lasted a whole day. It was like a gush,
but still,
it was like whoa. I was crying. I was like really scared.
Holy
and then when everything was fine, and then they explained like at this point in pregnancy, like as the placenta started to take over, there could be some bloody discharge. Like it just could be nothing. But no one tells you that.
Yeah.
You know? Like I wish they would tell you, like, I think you should still go get checked out. But it's like, even the knowledge of, okay, bleeding could be a sign of a miscarriage, but it could also be a sign of normalcy. You know?
Yeah. Actually, I guess when you get pregnant, it would be nice to know, like, kind of biologically what my body is about to do. So that way, if I do see certain effects happen, you know, I don't think that I'm dying.
Yeah, absolutely.
Okay.
Absolutely.
Okay, yeah. Cool. Yeah. All right. Well, I think that was great. I'm going to go through just a couple just to make sure that we kind of covered everything about, you know, what they don't tell you. What advice would you give to other people on being able to manage their highs and lows during pregnancy?
I mean, first I would evaluate why there's a high or a low, like what is happening at the time that is impacting you. There's usually an answer in there somewhere. Okay. You know, what's bothering you. Is it fear? Is it some outside factor? Is it relationship stress? Like whatever it is. I would evaluate that. I would definitely focus on breathing as well. Like slow down, breathe, whatever it is that you're afraid of. Maybe there's nothing there to be worried about. Maybe it's a sign you should go and get help or ask your doctor questions. Or I would definitely rely on your support system too.
So it's a lot of what I'm hearing is a lot of the advocating for yourself.
Yeah, you really have to. And you have highs and lows. And I understand not everyone has a great support system. I totally understand that. But if you do have a good one, lean on them, right? Even if it's just explaining what your high and low is, or if it's you asking for something that you need.
So if you don't have a good support system, what resources did you use that really helped you out, like made you feel either community or actually gave you really good education? Like what can people look up or read?
I think books like, you know, What to Expect When You're Expecting, any book that kind of speaks to your journey. But online community can be really great too. You know, if you don't have a good support system, get online, join a Facebook group. Like some of those groups really are super helpful. Some of them maybe not so much. You know, if you go in a group and you're like, yeah, I'm not crazy about this one, find a different one. But online community can be really helpful, even if it's just you posting like, hey, I'm experiencing this. There's someone else out there who for sure is experiencing the same thing.
Oh, good.
And it feels less lonely.
So community, mass community. That sounds great. And then these two questions I'm actually really excited to get your take on. So how does pregnancy affect relationships, both with you and your partner? Like how has it brought you guys together at all? Like has your dynamic changed at all during this?
I think it's brought us closer. I wouldn't say our dynamic has really changed very much, but I'm coming from a very lucky place in that regard. Like we've always had a good relationship, and Andrew always goes above and beyond to help me out, without me even having to ask most of the time. So it's brought us closer in the fact of like, we both went through the miscarriage, right? We were both going through this journey of like, we're about to be parents. And so we'll have conversations about not just what I'm going through, but what he's going through too.
Oh, good.
Because he's going through it in a different way.
Yeah.
And a lot of times your partner doesn't feel as connected to the baby because it's not their body.
Mm-hmm.
And so we try to make time for like him to connect with her. It's made us closer. And had really more of a positive impact.
It sounds like you have more of an appreciation for him.
Yeah, absolutely. And I know that's not everyone's journey. You know, I hate hearing stories of like some people do get pregnant and then they experience an unsupportive partner, and that's really sad.
Yeah,
when I hear that. But that has not been my experience.
Oh, good.
Yeah.
Good job. Yeah, badass. Have you noticed a change in him? Like, do you see anything paternal or anything that maybe he gets excited about that he wasn't excited about before?
I think he's been more open with his emotions than he normally is.
Wow.
He's not he doesn't really open up about his emotions very much. I think he's been more open to that. And then, you know, like with the political stuff.
Oh, yeah.
That we've been experiencing and like just that feeling that like we really don't give a shit about women and like we're having a daughter. And so like he's opened up about that too.
Oh, wow.
You know, that he like worries about her and me. And so that I think he's been more open in that regard.
Okay. And with your therapist hat on, what would you say, what conversation should couples have before the baby arrives to prepare for the changes of pregnancy and parenting? What would you suggest?
Well, there's quite a bit. If you're like still on your pregnancy journey, I would discuss what measures you're willing to go to get pregnant. Meaning like, are you open to IUI? Are you open to IVF? Are you open to surrogacy? Are you open to adoption? Like all these different routes, I think you really need to talk about because one partner or both might draw the line somewhere. Like I know for me, I wasn't going to do IVF.
Okay.
I'm not knocking anyone who has. It's a very viable option. Mm-hmm. I just personally didn't want to go through that experience.
Yeah.
And so that for me, I was like, if that ever meant that we wouldn't get pregnant, I'm just not going to do that, you know? So you have to have like those honest conversations. I would also talk about how you feel and what you would want to do if your child is born with a disability.
That's a good conversation.
Yeah. Right? Like, how do you feel about that? And like, even talking about that before you get pregnant, right? Or what if your child, like never becomes fully independent and you're going to have to take care of them the rest of their lives? Like, how do y'all feel about that? Because some people, it's no issue. Yeah. They're willing to do anything. Some people might be like, I don't know if I want to go through that.
Yeah.
Right? And so that would be a good one to talk about. And then I think it's also good to talk about not losing yourself to parenthood, right? Meaning like Andrew and I have talked about, even when she's here, he still needs time with his friends and I still need time with my friends.
Yeah. You're still two people.
We're still two people. Mm-hmm. We don't want to quit the things that we love to do. And we're both comfortable with, you know, taking a break every now and then. Yeah. And then how we feel about like childcare and, you know, who we're comfortable babysitting. And so you go through
that is also a really good conversation. Mm-hmm. Yeah. Wow. Mm-hmm. Okay. Yeah. Those are good suggestions.
Yeah.
That was badass. Okay. All right, guys. Yeah, that's a little bit of, just so you know, just a little bit of what Lyndsey's experienced that she was never told, like what, you know, the conversations that no one ever had with her beforehand. So, yeah, that was good.
Yeah, absolutely. So thanks, everyone, for tuning in. I mean, this was definitely an interesting one for us to talk about and kind of nice to get into the personal weeds of all of this. So let us know what you think of this episode and what you might want us to expand upon, because we can always revisit pregnant. There's so much you can get into. We can always revisit this, but let us know what you think, what you'd like to hear about. And we are also open for listener support. And so we have a link in our bio if you want to support us, even for as little as 99 cents a month. That would really help. We can continue creating content moving forward. So
yeah. And again, guys, this is very much a space where we want to build a community that's helping each other. So, I mean, we gave you a little bit of what Lyndsey's experience was and the things that she didn't get told. That was very unexpected to her. But I'm calling you mothers out there, is please put it in the comment section. What were some things that you had no idea you were going to experience that kind of shocked you when it happened, because if we can help a new mother out there, then it's a good episode.
Absolutely. All right. Well, thanks for tuning in. Again, we are Sex Positivity Unfiltered, and remember to stay curious and fuck politeness.